Hey all, so I just want to make another video. I know it's been several months, but I didn't really have too much to say at the time, so I just wasn't making videos, but I guess I have a lot going on. So I figured I'd make a transition life update. I am 10 months on testosterone. I just did my blood work recently at the trough of my cycle, and they said my levels were still way too high, and my dose that they gave me was way too high. I was doing 0.5 every week, and my levels, testosterone levels, were so high it was actually converting itself back into estrogen. So I had crazy high testosterone levels and then crazy high estrogen levels, and it was just like a hot mess. So they just lowered that, which they say that should help with everything. It should help my acne kind of go away a little bit more, and hopefully just make me feel better, just overall, because I wasn't feeling too hot. I was just feeling a little just frustrated a lot, and I still am, but I think it was a result of my testosterone dose. So I'm hoping, you know, that helps. And she says because it was such a high dose, I may have like missed out on some of the changes, and that like by lowering it might actually help things like facial hair come in more and stuff like that. Like I still shave twice a week. It's not like facial that like doesn't come in. It just comes in slower than I would like. But yeah, so that's that. I'm hoping that goes well. I have to start doing my blood work once a month, just until everything gets a little regulated again. But yeah, other than that, I don't know. I guess I have a lot going on. I am having my surgery in Salt Lake City, Utah, with Dr. Cori Agarwal. I think that's how you pronounce it, at the university over there. And I'll post that information down below. But yeah, no, I'm really excited. My therapist just wrote my letter and sent that over. So I'm scheduled for October 15th. Which is really close. It's like 9 weeks away. But it's also really cool because my testosterone date was October 15th. So it's going to be my 1 year on testosterone, and then it's going to be my surgery date. So I think it's really cool that it worked out the way that it did. So yeah, no, I don't know. It's just exciting, and I'm ready to just be done with that. I went to the beach this weekend, and I was thinking to myself, like, this is going to be the last time, you know, I'm ever going to go to the beach, you know, binding or with a shirt on, or, you know, it's just a good feeling. So I'm really excited to just live my life and be happy. And I'm also really happy they figured out what was going on with my dose and stuff, and that I have a better doctor now who's a little bit more competent and more aware. My last doctor was very trans friendly, but not very trans knowledgeable. So he kind of he started me off way too high. I was starting at and I guess I was excited. I should have known better. I should have said something, but I was just excited. I'm still really young. I didn't know to question him. I just kind of had faith in medical professionals and assumed that, you know, he knew it was best, but, you know, I guess he didn't. But he started me off at, I think it's 1 cc every 10 days is what was my starting dose. And a few months after that, I told him, I was like, you know, yo, like, I'm feeling, like, angry and just frustrated all the time, like, you know, and they did my blood work again, and it was, like, through the roof. I was, like, my testosterone levels were at 1,530, I think, when it's supposed to be somewhere between like 200 and 1,000, and that was at the trough of my cycle. So it was really excessive. So they lowered it by doing 0.5 every week, but which would have been like 1 cc every 2 weeks versus 10 days. But I guess it was just still way too much, and I thought lowering it once, you know, would have been good. And I should have kept up on my blood work, but I didn't, just because my doctor had passed away, and it was just hard finding a new doctor, and doctors make you really uncomfortable. So I think I was a little hesitant as to getting with a different doctor and like meeting new doctors. So I don't know, I just kind of got anxiety over it, and so I just didn't go, which is probably the worst thing I could have done for myself. But yeah, no, things happen the way they do. You know, life just does what it's gonna do. So now I'm just gonna take, you know, this experience and my experience with certain medical professionals, and use it to educate other people on, you know, knowing your dose and knowing what a good dose is to start at, and, you know, educating people that your doctor, you know, even though they're supposed to be there for you, they might not always know, and it's not because they don't care, it's because, you know, there's just not a lot of research out there. There's not a standard practice for, you know, how much to prescribe testosterone. It's kind of just up in the air, so, you know, I guess I'm going to do the same thing I do with everything else, every other experience I have in my life, and I use that to put out in the world as an education format, so people don't, you know, make the same mistakes that I did. But like I said, everything, you know, it's going to slowly correct itself. She said my voice might drop still a little bit, which is kind of unusual, but she said because they're lowering my dose, and then bringing it back up. She says for some reason that might drop my voice a little bit more. I'm happy with where my voice is, but she just said that it could just be a factor in, you know, some of the changes she feels like I may have like missed out on. But recently, as far as just like stuff for like my acne, I was using skin scripts for a while, which was not working, and I recently started using Dr. Bronner's tea tree soap for like my shoulders, chest, face, everything, and it's really helped. And I've just been using that for like the last like week or so, and it's already like made a difference because my acne was like really bad for a little bit, so now it's just kind of like moderately annoying. But yeah, no, I think that's everything, because I talked about surgery and stuff, so, and my letter, so I guess I'll just update you as things go, and let you know everything with surgery and all the details of that coming up. So, and I'll post the information below for the specific surgeon. So yeah, alright, catch you later.